Welcome to Medcare Insights, your trusted source for expert healthcare guidance and essential medical knowledge. Stay informed, stay healthy, and let's navigate the path to better wellness together. Strong body, bright mind. Your health is our priority. From preventive care to advanced treatments, we're here for you.
Today's topic is pneumonia. Pneumonia. Pneumonia is an infection caused by bacteria, viruses, or fungi. It results in inflammation of the air sacs in one or both lungs. These air sacs, known as alveoli, fill with fluid or pus, making breathing difficult. Both viral and bacterial pneumonia are contagious, meaning they can be spread from person to person through inhaling airborne droplets released when someone sneezes or coughs. Additionally, you can contract these types of pneumonia by touching surfaces or objects contaminated with the bacteria or viruses that cause the illness. Types of pneumonia. Pneumonia can be classified based on where or how it is acquired. 1. Hospital-acquired pneumonia, HAP. This type of bacterial pneumonia is contracted during a hospital stay. It is often more serious than other types because the bacteria involved may be more resistant to antibiotics. 2. Community-acquired pneumonia, CAP. This refers to pneumonia that is acquired outside of a medical or institutional setting. 3. Ventilator-associated pneumonia, VAP. This type occurs in individuals who are on a ventilator and develop pneumonia. For aspiration pneumonia, this occurs when bacteria are inhaled into the lungs from food, drink, or saliva. It is more likely to happen in individuals with swallowing difficulties or those who are overly sedated due to medications, alcohol, or other substances. 5. Walking pneumonia. Walking pneumonia is a milder form of pneumonia where symptoms may resemble those of a mild respiratory infection rather than typical pneumonia. However, it may require a longer recovery period. Symptoms of walking pneumonia can include mild fever, dry cough lasting longer than a week, chills, shortness of breath, chest pain, reduced appetite. Responsible is Mycoplasma pneumoniae, but other bacteria such as Streptococcus pneumoniae and Haemophilus influenza can also lead to pneumonia. Pneumonia stages. Pneumonia may be classified based on the area of the lungs it's affecting. Bronchopneumonia. Bronchopneumonia can affect areas throughout both lungs, often localized near or around the bronchi, which are the tubes leading from the windpipe to the lungs. Lobar pneumonia. Lobar pneumonia affects one or more lobes of the lungs. Each lung consists of lobes, which are distinct sections of the lung. Lobar pneumonia can be divided into 4 stages based on its progression. 1. Congestion. In this initial stage, the lung tissue appears heavy and congested due to the accumulation of fluid filled with infectious organisms in the air sacs. 2. Red hepatization. During this stage, red blood cells and immune cells enter the fluid, causing the lungs to take on a solid, red appearance. 3. Gray hepatization. In this phase, the red blood cells begin to break down while the immune cells remain active. This breakdown causes a color change in the lung tissue from red to gray. 4. Resolution. At this final stage, immune cells start to clear the infection, and a productive cough helps to expel any remaining fluid from the lungs. Symptoms of pneumonia. They can include cough with mucus, fever, sweating or chills, shortness of breath, chest pain that's worse when breathing or cough, feelings of tiredness or fatigue, loss of appetite, nausea or vomiting, headaches. Symptoms can vary according to your age and general health. Infants may appear to have no symptoms, but sometimes they may vomit, lack energy, or have trouble drinking or eating. Children under 5 years old may have fast breathing or wheezing. Older adults may have milder symptoms. They can also experience confusion or a lower than normal body temperature. Causes of pneumonia. Pneumonia happens when germs get into your lungs and cause an infection. The immune system's reaction to clear the infection results in inflammation of the lungs' air sacs, alveoli. This inflammation can eventually cause the air sacs to fill up with pus and liquids, causing pneumonia symptoms. Several types of infectious agents can cause pneumonia, including bacteria, viruses, and fungi. Bacterial pneumonia. The most common cause is Streptococcus pneumoniae. Others are Mycoplasma pneumoniae, Haemophilus influenza, Legionella pneumophila. Viral pneumonia. Respiratory viruses are often the cause of pneumonia. Examples of viral infections that can cause pneumonia include 1. Influenza A and B. 2. RSV. 3. Rhinovirus, common cold. 4. Human parainfluenza virus, HPIV, infection. 5. Human metapneumovirus, HMPV, infection. 6. Measles. 7. Chickenpox, varicella zoster virus. 8. Adenovirus infection. 9. Coronavirus infection. 10. SARS-CoV-2 infection, the virus that causes COVID-19. The symptoms of viral pneumonia can improve in 1 to 3 weeks without treatment but are at risk of developing bacterial pneumonia. Fungal pneumonia. Fungi from soil or bird droppings can cause pneumonia. In people with weakened immune systems. Examples of fungi that can cause pneumonia include 1. Pneumocystis jirovecii. 2. Cryptococcus species. 3. Histoplasmosis species. 4. Coccidioids species. Risk factors. 1. Infants from birth to 2 years old. 2. People ages 65 and older. 3. People with weakened immune systems due to pregnancy, HIV, the use of certain medications, such as steroids or certain cancer drugs. People with certain chronic medical conditions, like asthma, cystic fibrosis, diabetes, COPD, heart failure, sickle cell disease, liver disease, kidney disease, hospitalized patient on a ventilator, PTS with a brain disorder, which can affect the ability to swallow or cough, such as stroke, head injury, dementia, and Parkinson's disease. Diagnosing pneumonia. 1. Pneumonia is initially the clinical diagnosis with abnormal lung sounds such as crackling. 2. Chest X-ray looks for signs of lung inflammation. 3. A blood culture is used to confirm an infection. 4. A sputum culture was sent to a lab to be analyzed to identify the cause of the infection. 5. Pulse oximetry can indicate whether the lungs are moving enough oxygen through the bloodstream. 6. CT scans provide a clearer and more detailed picture of the lungs. 7. Bronchoscopy is used to diagnose lung inflammation if the initial symptoms are severe, or if hospitalized and not responding well to antibiotics. Treating pneumonia. Oral antibiotics can treat most cases of bacterial pneumonia. However, many cases of viral pneumonia clear on their own with at-home care. Antifungal medications are used to treat fungal pneumonia. Complications of pneumonia. Worsened chronic conditions include CHF, emphysema, COPD. Septic shock and organ failure. Lung abscesses may require drainage or surgery to remove the pus. Impaired breathing may need to use a ventilator. Acute respiratory distress syndrome is a medical emergency. Pleural effusion may become infected and need to be drained. Preventing pneumonia. In many cases, pneumonia can be prevented by getting vaccinated. There are several vaccines that can help prevent pneumonia. Prevnar 13 is effective against 13 types of pneumococcal bacteria. Children under age 2. People between ages 2 and 64 with chronic conditions that increase their risk of pneumonia. Adults age 65 and older, on the recommendation of their doctor. Pneumovax 23 is effective against 23 types of pneumococcal bacteria. Adults age 65 and older. Adults ages 19 to 64 who smoke. People between ages 2 and 64 with chronic conditions that increase their risk of pneumonia. Flu vaccine. Pneumonia can often be a complication of the flu, so be sure to also get an annual flu shot. Everyone ages 6 months and older gets vaccinated, particularly those who may be at risk of flu complications. COVID vaccine. COVID-19 can lead to pneumonia and recommends that everyone 6 months and older should receive an updated COVID-19 vaccine. HIB vaccine. This vaccine protects against Haemophilus influenza type B, HIB, and recommendation all children under 5 years old. Unvaccinated older children or adults who have certain health conditions. People who've gotten a bone marrow transplant. Vaccines won't prevent pneumonia, but vaccinated PTS more likely have a milder and shorter illness as well as a lower risk of complications.
Thank you for watching Medcare Insights. If you found this video helpful, please give it a thumbs up, subscribe to our channel, and share it with others who might benefit. We'd love to hear your thoughts, so drop a comment below. See you in the next video.